Hello everybody. Welcome everyone to today's webinar. I'm Cristina Lumbreras from EENA. We are delighted to have you with us for what promises to be an informative session. We are honored to welcome David Fredman from Heart Runner in Sweden, and he's also Vice Chair of the EENA Technical and Operations Committee, and Erik Prytz from Linköping University in Sweden. So they will share their expert insights on the motivations and demotivations for volunteer responders. You can, on the practical side, you can activate captions if you want to. You see the slides which explains how to do it. And after the presentations, we will have a Q&A session. You can use the chat, or you can also raise your hand. And I also want to mention that the recording and the slides will be made available on our website. And let's start. I will give the floor now to David.
Yes, hello, thanks very much for the invitation and welcome everybody. In the last 20 years, resources not usually part of the traditional emergency medical services, such as semi-professionals and alerted volunteers, have increasingly been used to provide support in emergencies throughout the world. And in Europe, many countries use organized or unorganized volunteer responders to reduce response times and also improve outcome in time-critical emergencies, such as out-of-hospital cardiac arrest. And the European Resuscitation Council actually even mentioned establishing such systems as among the top 5 interventions to increase survival in out-of-hospital cardiac arrest. And several scientific publications on the effect and outcomes of such systems are present. But apart from that, retention of the active volunteers who can provide this type of support is important to actually keep them as active responders and to have them as a power to rely on. But also for expanding existing initiatives to provide better coverage. And 2 aspects that needs to be taken in consideration when it comes to retention are the experience and motivation of the volunteers. What engages them and draws them in, and also what keeps them as a power to be relying on. And in a recent study titled "What Motivates and Demotivates Emergency Response Volunteers," a survey-based factor analysis study by Dr. Erik Prytz and his colleagues from Linköping University in Sweden, they analyzed which factors that has the greatest impact on volunteers' motivation to continue being volunteers and act. Dr. Prytz holds a PhD in human factor psychology from Old Dominion University and is currently a senior associate professor at the Department of Computer and Information Science, and also board member of the Center for Advanced Research in Emergency Response called CARER. And now I'm glad to say that Erik will walk us through the rationale and method of the study, where over 5,000 volunteers responding to cardiac arrest alerts in Sweden received a survey on the motivational and demotivational factors to become and keep acting as a volunteer. And to summarize the most important takeaways, including how to organizations that alert volunteers, how they can work to maintain a high level of motivation going forward. And I hope that you find this as interesting as I do and encourage you to ask questions after the presentation and maybe reach out to Erik and his colleagues at CARER for potential collaborations. Erik, the floor is yours, and take it away.
Thank you very much for that introduction, David. And I'm going to start by doing the most stressful part of any online presentation, which is sharing my slides.
Doing a great job.
Thank you so much for the encouragement. I feel like that's very important to encourage each other.
Yes.
So I hope that you all can see my slides at this moment. And again, David, thank you for this very nice introduction. As David said, my goal of today is to present our study so that you don't have to read it, just so that you can, enough that you came, you listen to this, and you can showcase all of your colleagues what has been done in recent research. The study that I will talk about today, like David said, is the study on what motivates and demotivates emergency response volunteers. You can find it if you Google any of these sort of keywords that are on the slides, the title or the link below, and you will get the slides afterwards as well. You can find it, it's available open access, and you can download it. I also want to acknowledge my co-authors, Petter Norblom, Sofie Pilemalm, Tobias Andersson Granberg, and Carl Oskar Johnson, who was part of this study. And we're all affiliated with this Center for Advanced Research in Emergency Response Carer that is doing a lot of other things as well. So if you found this study, or if you find this study interesting, I encourage you to look out what else me and the others in Carer are doing. And feel free to reach out if you have any questions, comments, ideas for collaborations, or future studies or practical problems that you want research to highlight. I see that David put a link to the study in the chat already for those who want to follow along with the written text as when I'm talking. That works. So just to sort of provide some of this background that David was talking about, volunteers, and I know that this term volunteers have different meanings to different people in different countries, different emergency response systems. We're talking specifically volunteers here within emergency response, not other types of volunteers. And we're talking about those who are perhaps a little bit outside of the traditional professional emergency response systems. Here in Sweden, at least, the rescue services, that is firefighters, and the police and the emergency medical services are all professionals. We have essentially nurses staffing the emergency medical services. We have a 2-year education to become a rescue service member, and police is also a bachelor's level education. But surrounding this, we have these volunteers who are on a sort of spectrum from more or less organized. So we have, I think we all can agree that whenever an accident happens, there are people around who will react and spontaneously help. Immediate responders, sometimes called, or spontaneous volunteers. And then all the way up to slightly more organized, who will show up to larger events and perhaps organize in spontaneous groups, but they come as a group, all the way up to large organizations such as the Red Cross, or at the Swedish municipal level, something called CIP, or I think in English we can say community first responders. And they are arranged on a municipal level, usually in collaboration with the local rescue services, to act as a sort of extension to the rescue service on a volunteer basis. They respond to things like small fires, some types of traffic accidents, not the ones on highways involving multiple vehicles, but perhaps on smaller roads. They respond to cardiac arrests and other specific types of sudden illnesses and accidents. You can see some of them in their nice yellow vests up there. And then we have people like that are called SMS lifesavers, or those who sign up to be volunteers to receive an alert in their cell phones that a cardiac arrest has occurred close to them. And then they will respond and provide CPR or use an AED. All the way up to large international organizations such as the Red Cross, of course. For this particular presentation and this study, we are looking particularly at volunteers who are dispatched to they're receiving some sort of alert to respond to an accident or an injury or sudden cardiac arrest. So we're not necessarily looking at the types of volunteers that are more long-term or showing up for doing other type of volunteer work. And like David introduced here, the idea that these volunteers are becoming increasingly important to our response systems, at least in Sweden and I know in other countries as well, because essentially the response systems they never have enough resources. They're always resource constrained. You never have enough people or stuff to do the things you want to do. And volunteers is essentially a free, quote unquote, resource. Suddenly you have more people that can do things, and they are volunteers. They don't ask for payment, which is great. You have more resources in your system. But this is only good if you can actually count on these volunteers to show up when they are needed. They are volunteers. They can choose to not respond. They can choose to stop being a volunteer, especially if they feel like they're taken advantage of or this is not what they expected. So retention and the motivation of these people to be volunteers and keep being volunteers is very important. And that is the sort of practical background to the study we made. I'm just going to show you the three main aims that we had with this study: to explore the common factors that underlie volunteer retention. And I'm just going to preface with saying that this has been studied quite a bit in the research literature. And so there are a lot of things already, and we wanted to sort of find commonalities among these things. And then, as step number 2, we wanted to examine how these factors relate to volunteers' motivation, especially kind of figuring out what is the most important things out of all of these things. And then, for third, we wanted to look specifically at something that has been not studied so much to date, which is alerts and alarm fatigue. And I will come back to what that is in a little bit. I should also just highlight the limitations of this study so that you don't believe that we finally have all of the answers. This was a huge thing with multiple researchers. No, we were a small group of researchers here in Sweden, and this was led by a master student who did this as an 8-week project. So that was a sort of our resource constraints, even though we volunteered our time a little bit more than that. That was sort of put some limits to the scope of the study. And also that we looked in Sweden, and particularly 2 volunteer initiatives in Sweden. So we make no claims that this is necessarily generalizable directly globally. I think there are some lessons learned, absolutely, that we can sort of share with you internationally, but just keep in mind that these are the people that we were looking at. Now, if I were to go on and present the previous research on emergency response volunteer motivations, we would be here for a lot longer than I have been assigned time to talk about. It would be great fun to talk about all of that, but I will respect your time. There's been a lot of research on what motivates people to be response volunteers or what keeps them being response volunteers. And I just want to summarize on a sort of a meta level that a lot of this research is typically qualitative in nature, because you want to look at a particular group of people, a particular group of volunteers, and you sort of gather these people or some representatives of these peoples, you interview them, you do workshops, focus groups, or that kind of stuff, to get a sense of why do you volunteer, what makes you don't want to be a volunteer. And this is great because it gives this rich story-driven research that sort of tells this is the motivations. You get a rich data set. You can explore things without any preconceived notions. If something interesting shows up, you have an interesting finding, you can follow up on that. So all of that is great. However, when we did the work of trying to summarize these things, we also run into this problem of how do we actually compare or contrast these different findings? If we find a lot of different things being relevant to volunteer motivations, how do you know what is most relevant? Most of these qualitative studies are based on very few participants who then their stories get a sort of big weight, speaking for a big group of volunteers. So I'm going to show you a slide that sort of summarizes some of the previous literature. And this is one of those slides that I would be critiqued for if I were actually to submit this presentation to someone who's public speaking class. They would say, Erik, this is too much information on one slide. So I would just say, don't try to read this. But here are some of the things that we found when we did the literature review. Just all of these different categories that you see on in my at least left-hand column. I can bring out a laser pointer here. Different themes that we found. If you just, we were reading all of this literature, we're finding literature, what is important for volunteer motivation? And we find, oh, community is important, and it's inherent motivation, external motivation, it's psychological impact, and so on and so on and so on. This is another, is more of the table. And here somewhere we realize that there's too many things here. We are starting to lose the forest because there's too many trees in the way, right? We have all of these things that are being said being very important for volunteer motivation, but how should we compare and contrast these things? How do we know how to increase motivation if we need to take into account all of these things? So what we wanted to do is take all of this big literature and just sort of condense it down and then make one study that sort of compared and contrasted some of these things. Now, here in the middle here, I have alarm fatigue, and I promise you I would get back to that. Alarm fatigue is not something that has been necessarily researched so much in this context. Not all emergency volunteer groups are the type of volunteers that respond to alerts. But we are interested in that type of group, sort of the SMS lifesavers or the community first responders in Sweden that do get alerts, some sort of they get dispatched essentially. And when it comes to dispatch, then there is an intrusiveness to the volunteer's daily life, that they have to stop what they're doing and they have to respond to something. And we know that in other contexts, that type of interruption in your daily work life or private life is draining. It is associated with some sort of emotional or energetical toll, essentially. It has been mostly studied within healthcare, where we have a lot of alerts, especially if you look at sort of an intensive care unit, with studies showing that an intensive care unit, you can have about 40 alarms per patient, going off 5 to 16 alarms per hour, of which about maybe 1% is clinically relevant. And so alarm fatigue has been studied in that context, that nurses and doctors in those contexts stop responding to alerts because essentially they think it's too tiring. Perhaps we're not thinking that a SMS lifesaver will get 16 alerts per hour. That would be some sort of mass epidemic cardiac arrest that I don't think is feasible. But perhaps just one alert a week is enough to make someone fatigued as a volunteer. So there's this sort of general concept or phenomena that could be generalizable to this context, and we wanted to include that as well here. So just to summarize again, we found all of these different factors or themes when we looked at the literature: community, camaraderie, satisfaction, need for support, alarm fatigue, and so on and so on and so on. So now we come to the how can we actually find what matters the most? Our approach to find an answer to this was to use a quantitative survey, unlike the others who have been more qualitative oriented with interviews and focus groups with few participants, perhaps 10, a dozen. We wanted to make a larger survey study where we put all of these data points into one analysis. To do this, we built a survey that was about 48 questions, where we took all of that literature that I just showed you and we sort of condensed it, asking a few questions per theme. So that was 32 questions. And then we looked at some of the other already existing surveys from self-determination theory and the volunteer motivation scale to add up 14 more questions of other factors that we know have been more theory inspired to motivate people. And then we also wanted some outcome measures. We also asked about people's motivation to continue as a volunteer. Will you continue being a volunteer next year? Essentially was the outcome measure that we wanted to include in later analyses. And then we asked also some background questions: age, gender, professional background, and so on, to see who are the respondents. Here are some examples of the questions, and they were all on Likert 1 to 7 scales of agree, do not agree to totally agree, of do you feel a duty to be a volunteer? I would like to know what happened to those affected. So there's sort of a lot of different types of questions, 48 in total, looking at things that have been mentioned in the previous literature as relevant. Now, we wanted to recruit people who were over the age of 18, mostly because of research ethics. It's much easier. And we wanted to find, we selected 2 volunteer initiatives in Sweden. There was registered SMS lifesavers, thanks to our contact via Carrot to David, who had the necessary email lists to reach these people. It's always nice when you have a person sitting on this sort of rich participant pool that is untapped. And then we wanted the community first responders, who is a different type. They're more on the rescue service side. They do respond to cardiac arrest as well and medical emergencies, but they are a little bit more on the fighting fires and going to traffic accidents. The problem with those, though, is that there is no David associated with the community first responders. There is no list. There's no magical bank where we could just reach out to everyone. We had to go through personal contacts. They usually have local Facebook groups. Again, this is arranged on a municipal level in Sweden and not nationally coordinated. So some of Sweden's over 200 municipalities have these, but not all of them. And even if they have them, it's not even clear that who's really a member. There's no member lists. So that was a little bit more challenging, but we were finding them all the ways we could. We sent out the survey and we got 5,347 respondents pretty much within a few days, which was great. Volunteers, they also tend to volunteer their time to surveys, it appears, which was great to see. Now, some of them, 23, were not even volunteers. They were other people who just found the link and responded anyway. We applaud their efforts, but we had to remove them because they're not volunteers. And then we had about 155 who they volunteered their time, but they couldn't quite complete things all the way. So less than 50% completion, we removed them as well, leaving us with just over 5,000 people as the final respondents. And just to show you a few pretty graphs with beautiful colors, who were these respondents? Well, we had a pretty even mix of men and women, which was nice to see. 2,367 women and 2,789 men. Quite a few of them, slightly more than half, was professional in the sense that they were either from healthcare, they're working within healthcare, rescue service, or police. So in some sense, these people are volunteers, but they are also, they have a professional background and they are used to responding to emergencies in different ways. So we wanted to sort of look at, contrast those as well with the, what we call here, lay people, those without any professional training or experience. We had a pretty nice mix of mostly about half larger cities, 50,000 or more inhabitants in a city. So they were operating, being volunteer in that context. And then about 1/4 in a small city setting and about 1/4 in rural settings. So out in the countryside, essentially, which is kind of important for some of the factors that we will get back to. It's also important to note that not all of these people had responded to alerts in the past year. About 1,800 had responded to an alert. Other people had signed up to receive the alert, but had not received an alert. About 3,200 had actually received one alert. The others had signed up to be a volunteer, but not yet received an alert, which, considering that if you have 5,000 volunteers who are going to cardiac arrests, of course, not all of those will thankfully get an alert every year, especially if there's multiple people in densely populated areas. So just that's important when we interpret the results, that some of these are responded as they feel without actually having done the responding part, but they are signed up as volunteers. They're still volunteers. We're still interested in their take on things. On average, though, about 2.3, 2.4 alerts per year on these people. And then since so many had no alerts, that also tells us that some people had a lot of alerts. And some of them were both community first responders and civilian and SMS lifesavers and had a professional background. So they might be responding to a lot. And on average, about 3.5 years as volunteers. So given that we had this beautiful data set of about 5,000 people who responded to our 48 questions, what did we do with this data set? We wanted to, like I said in the first aim, explore common factors that underlies these sort of themes that have been talked about in the literature. And to do that, we did something called an exploratory factor analysis. So everyone who knows what that is, you can stop listening for a few minutes because I will just briefly explain what it is. And I hope the rest of you will be really interested. Now, I'm not going to talk about the statistical dark magic that goes on underneath my statistical computer programs, but just in concept, what does an exploratory factor analysis do? I feel like that's an important point for you to carry with you when we discuss and interpret the results we actually had. So what the EFA does is it's a statistical model that takes a lot of data inputs, bunch of variables that you measured, and these can be all kinds of different things. In our case, each item on the survey would be one variable, but it could be anything from physiological parameters to big surveys and subjective measurements, all kinds of things. The statistics doesn't care. And what it does, it finds patterns among these variables to say, hey, these 4 variables seem to move in a way such that they measure the same underlying phenomena, the same underlying factor. So essentially, it condenses from a large data set with a lot of different variables down to fewer, more manageable factors that are also the things that are of interest. Maybe not in our case, each individual question in the survey is not really that interesting, but the things that are underneath it, that is what is important, that we measure one thing. And I will come back to show you what the output looked like and what it means. We then wanted to see which ones of these factors that we get from this analysis is most important for a volunteer's motivation to continue being a volunteer. And to do that, we did a multiple regression analysis. And I do believe that anyone who stopped listening about EFA, because you already knew it, knows what that is as well. So you can keep not listening. And for the rest of you, essentially what we did is we took those factors that we got from the EFA, we put the output, the predictor value, the outcome measurement, the I want to continue being a volunteer next year question. And we could see which of these factors that we get have the best predictive value. What is it? Have a positive or negative impact on the volunteer's motivation to continue. That's really all you need to know about that. And then we also did some comparisons. Since we had all of this data and we could compare different groups, those who had responded to alerts to those who had not, those were professionals and not professionals, and just sort of see if there's any interesting differences there. I now welcome back everyone who has stopped listening a while ago. Please start listening again as we go into the results. I'm again going to show you a big table that I ask you, please don't read it. Please don't be super scared. Here it is. It's a lot of numbers, but I will walk you through what is important. You will see this. If you read the article, you will see this table is from there. But essentially, this is what the output of an exploratory factor analysis looks like. And the important parts that I just want to highlight is that to the far left here, we have items. Items means the questions from the survey. So question number 18, question number 19, and so on in a long list. And on the other axis here, we have different factors. This is 12 factors that the statistical model just sort of created, saying that this is what needed to explain the patterns in the data. It could have been 3, it could have been 25. God forbid, it could have been 46 because we put 46 variables in. That would have been horrible because then we measured 46 different things and that would not have helped us any. But the analytical method essentially landed on 12. And what it does is for each cell, it shows you how strongly that question loads onto that factor. And we as researchers then had to go in and say, well, what are those items and what is this thing? The statistical model had no semantics. It's just syntax, right? It's just numbers in, numbers out. It doesn't care about what we measured or what the question was. It's just these things go together. And for us, we need to find out, well, what is this thing that their statistical method has put together for us? So if you look at, for instance, for community, we have these items of 2, 3, and 1, right? And this is the questions that we asked. Question number 2 was, I feel that I help people in my community in my role as a volunteer. Question 3 was, it is meaningful to help others by being a volunteer. And question 1 was, I feel that I help society by being a volunteer. And the statistical model put these 3 together, and we then put a label on this. We said, it looks like all of these 3 questions concern the sort of social aspect of the relation to others that we can then call community. We could have called it social relationship, we could have called it something else, but in general, the point is that we found something about others. So we call it community in this case. For competence, or for this factor, then on factor number 6, we put the label competence, because all of the 3 questions that loaded onto that seem to be related to perceived competence, that people feel confident. So that is essentially the important thing to understand, that the statistical model puts out 12 factors. We have to interpret and put something on there to say, this is what they are. Here's a list of the definitions of these ones. Again, if you go to the actual article, you can read this. But what I want to say that is just the important takeaway here is that we didn't find anything strange, right? All of these groupings made sense to us. These are all things that we've seen previously in the literature that's come from these sort of qualitative studies, which is a good thing, because we didn't try to reinvent the wheel here. We just tried to put everything on the same sort of data set, and we did find 12 factors that seem to be in line with previous research, and also including alarm fatigue. Now we come to the interesting part of actually using these factors to see what matters the most. So to do that, we did the regression analysis. I'm going to show you another table. It's kind of a running theme of this presentation. Here's another table with a lot of numbers in it. And as a researcher, of course, I'm happy with the p-values. I care a lot about p-values. They're all statistically significant. I find that most people don't really share my passion for significant p-values, but given that we have 5,000 people, yes, everything is significant. What is more interesting is this column, bring up my lazy pointer again, beta. It's essentially the standardized weights of how strongly does this predict the outcome. And the outcome is the motivation to continue being a volunteer. Now, the absolute values are pretty meaningless, but look at them in relation to each other. That's where the interesting things start showing up. We can see that we had the three most strongest positive predictors were community, self-image, and competence. That means that community is essentially the strongest predictor for someone to continue being a volunteer in our data set. And it's quite high beta compared to the other ones. You can see that we have in this table, we have some that are very, very low. 0.04, yes, it's significant, but it's practically meaningless, essentially. And we also have some that are negative, like alarm fatigue. If people, you should interpret the negative factor such that the higher the alarm fatigue, the higher fatigue people feel after alarms or alerts, the less likely they are to continue being a volunteer, right? That's what the negative sort of thing means. And also negative experience was sort of a catch-all, that people experience something that they don't like about being a volunteer. So here we're starting to actually get to what I think is the most interesting part of this study, is that we can actually start to seeing all of these different themes that has emerged in the past qualitative research, and we can sort of look and see what matters the most. And in this case, it seemed to be community, self-image, and competence for the positive side, and alarm fatigue and negative experience on the negative side. And I should also say that this explained about 40% of the variance in the data, and that's a fancy way of saying that there's about 60% that is black hole. We don't know what, but it could be things that, you know, people are moving or quit being a volunteer for other reasons. We also compared some groups. I'm not going to say too much about these things. We just wanted to sort of look and see about, since we had the different groups. So for instance, we looked at people who had received alerts and had not received alerts, and people who had acted on alerts. And for those, we saw both had a feeling unneeded, had the same effect. So essentially, those who had received or acted on alerts had higher scores on feeling unneeded than those that had not. And this was puzzling at first, but perhaps this is an indication that some people respond to an alert and they get there perhaps too late. There's already professional responders or other immediate responders there, so they're not getting to help as they thought they would, or that the professional first responders are not really taking them as helpers, they're not letting them help. So we can have an effect of not feeling needed, essentially. We could also see a lot of differences between the professionals and non-professionals, such that the non-professionals had a higher burden after alerts, and which makes sense, because if you work with a profession where the sort of dispatch and alerts is part of your everyday profession, either you learn to cope with it or you've already quit, kind of thing. Same with alarm fatigue. That it was higher for those with a non-professional background. And competence, surprisingly, those with a professional background rated their competencies higher than those who had not, which makes perfect sense, I think. So in the interest of time and leaving some time for questions at the end, I'm just going to go straight to the conclusions with this. What did this study do? Well, we found 12 relevant factors for volunteer motivation that aligns with the previous research, but adds this component of alarm fatigue. And most importantly, it compares them to say what has the biggest impact on volunteers' motivation to continue being volunteers. It turns out community, self-image, and competencies are three of the strongest, but of course you can also look and see at the others. We also, I didn't show that contrast, but we also compared rural and large cities, and we found that those in rural areas had a stronger sense of community than those in larger cities. Again, not surprisingly, we would expect that. Rural areas, smaller communities, everyone knows each other, strong sense of bonding. Large cities, everyone's a stranger, right? But if we're thinking in terms of people being volunteers and community being such an important part of that, perhaps this is something we should look at in our volunteer groups and say, how can we increase the sense of community to retain more volunteers? As well as competencies, can we train people so that they perceive a higher level of competence so that they can actually keep being a volunteer? And on the other hand, alarm fatigue turns out to be a strong negative predictor. which means that perhaps we should think about dispatch algorithms that is not just who is closest, but perhaps taking into account this sort of fatigue effect. Can we actually, when given a choice of two equally viable people to dispatch the one that is not as fatigued, essentially? Or perhaps give an increased user control, saying that setting up wait times or putting some sort of do not disturb on certain times of the day or weeks. That kind of control could increase that they actually do respond when they actually do get an alert. And this negative experience that could be, which is, we interpret it more in the sense, not that it is a negative outcome after an event, because it could be. I mean, you respond to a cardiac arrest, doesn't always go that well, and that is a negative experience. But in this case, it was more about not being able to actually be the volunteer they wanted to be when they arrived to the scene, or that they didn't get to help, for instance. In which case, volunteer initiatives might have to work more with expectation management to explain this is what it actually means. And yes, you may get there too late, but that's still, you're still responding and you're still doing a contribution. We also saw that those who had no alarms had a higher negative experience, which could be an indication that if you sign up to be a volunteer and get nothing back, no alerts, it's a good thing because that means nothing is happening in your community. But on the other hand, you may feel that why should I be a volunteer? Clearly, no one wants my help. And that would lead to a negative experience, which would then lead them to quit. So perhaps that's something can be worked with as well to increase retention over time. That was a speed run of all of that study. All of the details you can be found in the link that David put in the chat. If you have any questions about that, just feel free to shoot me an email, be in touch, and I will be happy to take any questions right now as well. Thank you.
Thank you very much, Erik. And I just want to pick up on almost the last conclusion there, because you mentioned alarm fatigue. And I have the benefits of being in like the support flow of all the volunteers in both Sweden and Denmark. And I can tell you that they are more concerned about they don't get alerts than they get too many. But I totally get what you're talking about, because it might also be that are the ones that actually experience alarm fatigue maybe opt out, or they have such a feeling of responsibility that they just cope with it, but still is a negative feeling. Do you think that might be the problem?
That could absolutely be part of the problem. And I do think that you have both sides of the coin here, like you mentioned. You have those who sign up to be a volunteer and they get nothing, and they don't get to actually be the volunteer they want to be, right? But then I think either that people happen to live in this area or have set up for multiple initiatives that they can get quite a few alerts per year as well, and that might be draining. And some of the alerts, I mean, not all alerts are equal either, depending on when it happens during the day, what you're doing, what is being interrupted to respond to this. After all, we talk about volunteers that can choose not to go. Professionals can't do that. If a professional first responder said, nah, I'm not going to respond to this, we would probably fire them, right? But these people can actually say, no, I'm not going to go to that. And sort of doing that, one, which we saw in the survey, it can create feelings of guilt or anxiety in some people that I signed up to do this and I got an alert and I didn't do anything. I choose not to. What does that say about me? It's, that doesn't reflect well. And that might lead them to quit. Or it might just lower the threshold of not responding next time. It just becomes a habit to not respond to them, which again will not help us. If we have these volunteers in the system, they need to be to some degree reliable. That if we dispatch, we can expect someone to show up. So yeah, I think it's a thing to work, especially with the IT support, with dispatch algorithms, and make sure that we're getting the people who will respond and not tire the other ones.
Yeah. Do we have any questions from the rest of the gang who's here? Just please raise your hand or fire away in the chat, or maybe just unmute yourself. You're welcome. I'll pick up with another question that's always sort of puzzling me, also from my own background as a researcher. Who do you think would benefit the most from the results? Who is like, is it the volunteers, or is it the organizations? Is it the platform providers, or is it stakeholders at the state level? Who do you think?
Yeah, I think maybe not the volunteers directly, but all the levels above can have can take away different things from this study. Those who try to organize a group or manage a group could look at these results and hopefully be inspired to look at these factors within their own group. Like I said, this was a Swedish sample within particularly 2 different initiatives. Hopefully, and we found about the same thing that others have found. So I'm pretty confident that these factors, these themes are pretty universal, right? But if they could take a look within their own volunteer groups and say, what matters the most to our people, probably community, but it could be other things as well, and work with those things to increase retention by providing training or increasing the sense of community or something. Platform providers, I think, can look at other things such as the feelings of fatigue, perhaps, or other things where the platform itself could have an impact in how people, in people's motivation. I would also say that other researchers hopefully will be inspired by this research to look deeper into the things we found now. I don't think that this is the end all be all. We had a big quantitative survey, great. We have a lot of numbers, but numbers don't tell the full story, right? So again, perhaps we need to go back with a more mixed methods approach, looking at both the numbers and the qualitative approach of interviewing and making sense of these numbers a bit more and looking at, okay, so community is important. Then what? What drives feeling of community? What creates community? In what way does it matter? You know, looking at those things more in depth. I think that would be, there's a potential for great follow-up studies based on that.
Absolutely. And one thing that also like really strikes me, not only by reading this paper, but being in contact with the volunteers, and also I had the opportunity for the last 2 weeks to travel and spend time with other researchers in this field. And it's, at least in Sweden, I'd say, and in Denmark as well, we find these community responders, the volunteers, they are engaged in other means in society already. They are football coaches, they are helping with homework, they are Red Cross volunteers, and they respond to the cardiac arrest. And they are also in the home guard, or they are volunteering for other things. And this is something nice, but how much can we rely on the volunteers? Like, where is there a cutoff somewhere where we're gonna maybe overuse them, perhaps?
I could absolutely be, and I think that's because there's this strong internal motivation, right? Perceived self-image of someone as being a volunteer that is very important. We could see on the other hand, in our analysis, we found that external motivations was hardly a factor at all. So very few are actually driven by the sort of external rewards of not necessarily monetary, but recognition or something. Very few are driven by that. So I think I agree with you that there's probably individuals who are very voluntary and they do it a lot. And question is what will burn them out first, kind of thing. Hopefully not this, and hopefully they will still have the energy to respond to a cardiac arrest, which it's a life and death situation. So that would also be an interesting topic to follow up on, to see if those who are volunteers, what more and how can they balance these things, and how can perhaps a platform provider help them with that.
Yeah, and I think definitely goes for, and thank you to Jonathan Rida from Austria, giving a thing in the chat now. I think it would be interesting to see in how many ways the volunteers are already engaged. Like you're mentioning the Red Cross, there's also like citizen responder systems going on at least in Vienna. Are people the same? Are they Red Cross and volunteer responders, and they are also scouts or whatever? This could be something to learn more about, maybe what puts the society together.
I think it's important too, because one thing that has been discussed within my research group is this notion of the preparedness of society, right? And we believe that this increases preparedness in society. We have more people who are ready to respond. So when the professionals are busy, perhaps the volunteers can pick up and say, when we have multiple mass casualty incident, the sort of disaster scenarios, right? The problem is that it's the same people, right? More than half are professional responders as well. So you cannot count, they're not two people just because they're a part of both things. So once the big disasters hit, they will be occupied. All of those nice volunteers you had, they will be wearing their professional uniforms and responding. Yeah. So that's also an important point to keep in mind.
Yeah. And also the discussion that's ongoing within this really narrow field of resuscitation science, going for like trained volunteers equipped with cars and lights and sirens, and they are doing this on the free time, and then they work as healthcare professionals like on the paid time, or volunteer responders that are only not healthcare professionals. Because as you mentioned, sometimes everyone will be on another shift, and then you're left with, well, few resources.
Exactly.
Strength in numbers or strength in like capacity or skills. Is there any questions from the audience? Please fire away.
So yeah, I can find I found a tab called questions and answers that has questions, I do believe.
Yeah, there
So I will.
is. Great.
From Francisco Echeverria from Spain. When you refer to volunteers, are you referring to those who don't receive payment, those who only get paid when they are activated, or those known as part-timers who have scheduled shifts and must attend when activated? When I talk about volunteers in the context of this study, I'm talking about those who don't receive any payment. The community first responders, or the CIPs, and the SMS lifesavers do it purely volunteer basis. They want to do it, they do it on their own time. So there's no payment for those we have studied. And then I know that the volunteer terminology gets sort of fuzzy in the edges of when do you stop being a volunteer, when do you start being a professional. But in our context, it's those two initiatives that we've studied.
Yeah, and Francisco, this is a great question. And I actually spent a good part of 2 days in Germany, where specialists in this field still haven't got the wording right. They haven't got the terminology right. What is a first responder? What is a volunteer first responder or a community first responders? Whereas when we are reporting and writing the papers, first responders, that's not ambulance, but they are still dispatched and employed. So that's firefighter and police in Sweden, and firefighter in many other European countries. And then there's something else. And I think it's really important that we report the same if we are going to compare outcomes, or in this case, engagement. Being a volunteer could be so many things. And there is a work going on with this, trying to narrow down to call it the right things. But it's a great question, Francisco. Thank you very much. And thanks, Erik, for pointing this out there, the question and answer thing.
It's new to me as well.
Yeah. Great. Yeah, if there's not anything else, I think I've asked my prepared questions, and it's a great discussion. Again, Erik, thanks very much. And I would really encourage you, if you're in this field or if you're looking for it to go into this field, I really encourage you to reach out to Erik and his college at Linköping at the Carer Institute, because they are doing some remarkable stuff and are very turned towards collaborations. And that is great things for anything research and scientific. I really encourage to collaborate and be open with sharing the data. And thank you very much, Erik, for taking the time and for an excellent presentation.
Thank you very much.
Well, I think it's time to close the webinar. Thank you all for participating in today's webinar. A special thanks, of course, to our speaker, Erik, and also David for chairing this webinar. Remember that the recording and slides will be available on our website for further review. And we hope that you found the session valuable, and look forward to seeing you in the future webinars that we will have 2 that are already scheduled. Of course, we will have more, but the next ones will be on the 28th of May at the same time, 2:30 p.m. CEST, with the Mediate project. And we will have another one on the 18th of June at the same time for the core project. Thank you very much and have a great afternoon. Bye.
Take care. Bye.